It has been nearly a year since the coronavirus pandemic first hit and changed life for us all, and studies have shown that communities of color have been hit particularly hard by this health crisis. Each week, the city of Holyoke is consistently listed as a high-risk community according to the state's COVID-19 map. Nairobi Rosa Soriano, Director of Community Engagement and Resident Services at One Holyoke CDC, spoke with me about a new grant that the organization recently received to help provide education and resources to Holyoke residents to reduce the spread and rise of COVID-19 cases in the city.
Going back from the beginning and up until now, the changes in a lot of community events, in decreasing a lot of the community supports that are around for residents to be able to have some type of an outlet. I mean, that has been a huge effect. I know for our residents, especially in our elderly building, not being able to have events in our community room, they've been isolated. They're feeling a little bit of depression and just feeling really down. And then for those families have been affected, personally, I've had deaths in my family for COVID, and I know a lot of our residents in Holyoke that have had family members that they've lost to COVID. So I think it's been a huge effect emotionally, a huge, effect financially for, some families that have lost their income, lost their jobs. I know in the very beginning, I helped a lot of residents do unemployment claims. And at the beginning, trying to get a hold of unemployment was difficult. So I think that, COVID in Holyoke has affected a lot of residents in so many different ways, financially, emotionally, and just, really, and just in the physical aspect as well, trying to do things that they no longer, that they no longer can do.
And in order to address some of these issues that are affecting the residents in Holyoke, One Holyoke recently received a COVID-19 community grant. What is this grant? What's the goal of it?
Well, the grant is awarded through the Department of Public Health and Health Resources in Action. And the goal of this grant is to be able to promote and provide education and outreach to families in, high disproportionate rated COVID diagnoses. And so we're trying to make sure that all of our families within the community, especially the Latinx and Black communities, to have resources and information that they need to be able to understand COVID, know how to be safe around this situation, and really just try to get out as much information into the community as possible.
Now, there have been a number of national reports with data showing that these minority communities are being particularly affected by COVID. Working in Holyoke with the residents as closely as you do, why do you think some of those reasons are for this disproportionate cases?
Some of the reasons are large families, the fact that Holyoke does have lots of buildings and lots of congregated areas within those buildings. And so lots of multi-families within apartments. You have grandparents, children, grandchildren all living together. And so, some children that might have COVID and not really have any symptoms, but then, their grandparents are living with them and they're affected. So I think that is something that could probably be related to it. I think also just really having a community where people are used to congregating together in different events and doing things in the household. I think culturally in the Latino family, we are used to, I know that for myself, we're used to coming together for different activities and different things, and not being able to do that is a little different. And so I think that increases that rate of exposure.
What type of work is this grant going to allow One Holyoke to do in the community?
So a lot of the work that we are planning to do is going to be a good social media and, media outlet. It's putting out key messages, the 5 key messages. It's wearing a mask. It's washing your hands consistently. It's, if you're feeling that you're sick and you have some symptoms, getting tested. It's, staying home while, you have some symptoms. It's those, 5 key messages that we're going to promote using a lot of the funding. And we're going to, get the information out there in any avenue that we can, in radio stations, in local supermarkets, kind of like some of the work that One Holyoke did with the census.
Holyoke has a large Latino population. Will there be ways for this community to get information in their native languages?
Yes, absolutely. Most of, or hopefully all of everything that we're going to be promoting will be in English and Spanish. We're going to be doing some events via Zoom, and that has an interpretation application that can be added, so folks would be able in any language to tune in and have that information available in their native language. But a lot of the information that we're going to be sharing, where it's flyers, where it's information, it's going to be in English and Spanish.
Do you see, working with the residents in the community, have you seen a need for this information in their language? Is this something new that they haven't really had access to before?
I think that there's a lot of information out there in different languages. And I think that as it applies specifically to Holyoke, I mean, we have other organizations that have been promoting testing sites in English and Spanish, that have been promoting, just where they could get potential protective equipment. We have different associations that share or give out face masks and stuff and those flyers and that information is really displayed or shared in English and Spanish. I think that, doing more of it would obviously benefit the community. But definitely, I think that we are doing in Holyoke, especially because of the population, being so largely, Latinos, that definitely it is something that is shared in English and Spanish.
Beyond just getting sick and worrying about those issues with COVID, COVID has taken a toll on mental health, on businesses, on a number of things. Are there any other ways that you're going to support the community during this time through this grant beyond the, mask wearing, hand washing, those types of things?
I mean, we are going to be distributing things or supplies that we might need. We're going to be distributing them. So we're going to get actual equipment in the hands of families if they need it. We will continue to provide information and resources around, what's available for families that are with limited income or that their income has changed. And so we will be doing a lot of that as well. I know that for our tenants and for One Holyoke, we have shared in our website and in our social media just the eviction information, and if they were to be approached around eviction, what their rights are. And our executive director Michael Moriarty has shared that information so families can become aware of what their rights are and how they can protect themselves from eviction and things like that.
Now, for you personally, what would you love to see the outcome of this grant be?
I mean, my goal would be to reduce the COVID rate. Right now, we're in the red in the city, and in just trying to really have as many families, promoting safe usage and not, trying not to congregate, trying to stay within the household families. I think I'd like to see Holyoke get out of the red. I'd like to see that we are, that our numbers are decreasing, that people are maintaining that safe distance, that people are wearing their masks to reduce the risk of COVID, diagnosis and all of that.
This time has been challenging for all of us in many different ways. How does it feel for you to be part of this work, this community work that you're doing?
I mean, for me, it's inspiring, it's rewarding, it's how can I get information out to my community? The fact that we have a team supporting us, believing in what we do for community engagement, believing in that, we're out there, we're in the community. I mean, we did a lot of work with census, and so now it's COVID, and it's like, what else can we get involved with? How else can we share information to families to reduce risk and to, increase education and increase access? Whatever One Holyoke can do to be able to meet those needs, that's what we're there for. So I think that for me, it feels so rewarding to be a part of an organization and to receive certain grants that can really make an impact directly to families that either we serve because they are our tenants or they live in our apartment buildings, or that live in the area where we are. We're in Holyoke. And so to be able to impact families right within our city, I mean, that makes it very, very inspiring and very rewarding for me.
What should residents of Holyoke be on the lookout for this campaign?
We have created a new logo for this campaign where it's Holyoke Stay Safe. So you'll be seeing that badge in our social media. You'll see it on our website. We also are going to be creating a link to our website, a new kind of direction page that will have a lot of the resources and things that we're sharing on there. You'll see us in the different outreach events that we will be doing. You'll see us being able to provide some supplies and some of the information with this new logo. So look for that. Once you see that logo, that's part of this grant and trying to get that information out there and share it with your family members and share it with other community organizations so that, we all have one place to know where a lot of this information for Holyoke is going to be.
And what are some of the resources that will be available to community members through this grant?
Some of the resources that we are looking into having are, face masks and gloves and, face shields and goggles and cleaning and disinfecting things, and just really trying to keep our city and our residents with as much supplies as possible to be able to be safe around each other, whether it's they're in their own household or whether it's at work or, in their buildings. And so just really being able to get as many things to the residents of Holyoke as possible.
And are these resources free for residents of Holyoke? And do all residents have access to these resources?
Yes, all the resources will be free, and all the information will be free, and all residents have access to it through our website, through our social media pages. They can follow, links to our website, which will tell them exactly where we'll be or what we're doing and what's next for this information surge that we're trying to get to everyone.